Okay, we are going to get started with our luncheon featured speaker. We are so delighted that Dr. Maissa Shawky, the Deputy Minister of Health and Population of Egypt, was able to rearrange her schedule on a very last-minute basis and come to Pittsburgh and speak to us today. The Health Minister of Egypt had been planning to come and was called away in an unavoidable conflict. And some of you heard me relate this morning what we went through to try to get Dr. Maissa to come to Pittsburgh on short notice without a visa. So we were able to, we had the folks at the U.S. Embassy move mountains really to get Dr. Maissa here. And it didn't hurt that the General Consul, some of you heard earlier, was from Pittsburgh. So he took a personal interest in this. And lo and behold, Sunday morning, Dr. Maissa was able to get the visa and was at the airport Sunday night. So we're delighted that you could be here today. You will see that there's an insert in your program that describes some of the many achievements of Dr. Maissa. Honestly, there is a book that describes the many things she has done, many publications, and you can look at this middle paragraph just to get even a taste of her focus on health, her focus on women and children and the elderly, and the things she's doing to improve the lives and health of the people of Egypt. And we are so proud that you could be here today, and we look forward to your remarks. Let's please welcome Dr. Maissa Mohammed Shawky.
Thank you. Actually, I'm very proud to be present among such a distinguished audience with lots of aspirations for Egypt. I'm Maissa Shawky, and I'm Deputy Minister of Health for Population. Actually, His Excellency the Minister of Health had new upcoming agenda that actually lost his presence and he couldn't make it up to Pittsburgh. He conveys his very best regards to you, and I think you will be meeting with him in Cairo very soon. So I'll give you a hint about how Egypt would like to have a good opportunity from our meeting today. So far we are concerned with doing lots of medical reform, healthcare reform in the Ministry of Health in Egypt at different planes. Maybe at the preventative plane, at the curative one, at the health promotion plane, binding most of them with the population development gears all over the country in the 27 governorates. So making things get better over there would actually take us to an area of collaboration and creating the common grounds for the needs and demands. What our friends over here in Pittsburgh are willing to offer and are very much interested should have a common ground with the demands of the Ministry of Health in Egypt and with the Egyptian partner altogether. So far we are very much into developing new states at the telemedicine part, and we have a history of success in doing this. Telemedicine part is going to bridge the two scientific bodies with creative outputs and outcomes in a very short period of time. We are also into raising community awareness about what is needed to be done to prepare for a good platform in the very near future. We'd like to have an agenda of what kind of policies are necessary for creating better chances of cooperation. Biotechnology also comes as a priority for my country and creating the links and the bridges for making Egypt a focus or a center for biotechnology synthesis and also its exportation to other Middle East countries is a very good opportunity for both partners, putting in mind the central location of Egypt within the whole Middle East. Maybe I would also highlight the importance of information technology. We have special foci in Egypt who have done so good about medical information technology upgrading, but it's not widespread nationwide, and this would create also very good chances for cooperation. Maybe we went into what about the NCDs in Egypt. In Egypt there is a national plan committed by the Ministry of Health and Population together with the WHO for having very good prevention plan for the non-communicable diseases, and it raises our interest in common if we can have a cooperation of this. We view NCDs in Egypt as a tip of an iceberg that worth a lot of attention and focus in the next coming future, and it's been also planned to put efforts for prevention and control at the primary healthcare level together with the recent international standards for prevention and control. Spheres of cooperation would include health promotion, prevention, management of disease or curative care, and also the rehabilitative care. Targeting health systems in Egypt, we are speaking about the rehabilitation of hospitals, upscaling of hospital delivery systems. We have right now a geographical health information system that maps all hospitals in Egypt together with allowances over there as regards the human resources, the services available, even the number of beds, number of doctors and nurses, the flow of patients, the degree of satisfaction of patients from the kind of care, quality of care over there, and what needs to be done is also mapped by a health information system run by the Ministry of Health. Maybe we're speaking about pharmaceuticals and areas for cooperation, and within each domain we think about, is it possible we establish pharmaceutical companies or factories, industrial work in Egypt? Can we invest in creating production lines within big pharmacies, within big pharmaceuticals? Can we think about manufacturing medicine over there? Can we think about manufacturing generics over there? All these opportunities are open, and actually along my 1 year appointment in this position, I have witnessed all. The choices being run with the establishment of new factories, establishment of new lines of production within established factories, and the development of generics and new medications. For population development, and this is the sector where I actually came over, we've done lots of efforts along the past year in order to actually improve the quality of the population. That's what we call the population characteristics, and we are working very hard on reducing our rate of natural increase, so economic development can show its fruitful results on the people. We reach for more satisfactory well-being. We also have the ambulance care in particular. It's been founded actually in Greater Cairo governorates. These are the very central 4 governorates in an attempt to upscale this all over Egypt. And this is important in my country because accidents are very common, especially so road accidents, and reaching for an ambulance using a system that's like Uber, for example, has created very good results in the last 3 months, and the availability of the ICU beds chartered through a digital system is much better for the outcomes of these emergency care. Maybe working for the population part, we are looking for public-private partnership all the time, and we believe as a government that the NGOs sector, together with the private sector, should be aligned with the governmental plans if we are to achieve better results in shorter time. I would like to hear from you about what policies could be hindering the mutual cooperation between those parties so we can have better results or better outcomes at receiving your great selves in Egypt next week. Before I end, I'm going to show you a short presentation snapshot of the Population Development Atlas in Egypt. I'm proud to say that this work has been finished like within 1 whole year of work. We used a composite indicators, 64 composite indicators to create a map for Egypt so we can prioritize our investment in population development, and we use traffic light colors to show up in a map for the policymakers. That's what we call a policy brief made easy for the different governors in the 27 governorates for the different ministries acting upon this, so where our priorities are by governorate, and within each governorate we had also another traffic light segmentation so the governor can work purposefully on the red zones. I need a flipper. So this is the conclusive result. This is a map. As you see, it holds 3 colors by governorate, and we aligned 9 governors. Our government has to prioritize allocating its resources for problem solving. And then when we reach more of the yellow color and more of the green color, this is going to give us an indication that we are on the right track. Sorry for that being in Arabic because I had very short time to deliver it in English. Actually, we have direct and indirect indicators. The direct indicators are speaking about the rate of natural increase, birth rates, maternal mortality rate, infant mortality rate, mortality rates for children below 5 years, and life expectancy. These are actual rates, and for the composite indicators, we used to group the rest of the 64 indicators in indicators reflecting family planning, health services, resources, women empowerment, economic situation, environmental conditions, education, and the population distribution. So we have these indicators actually objective, they are numeric, they are evidence-based, and they are statistically manipulated, or they are statistically equated in an equation to create a continuous variable that was divided into 3 parts. So we have the good, or the best, the relatively the best, and the worst, a little bit on the worst. This is all the districts in Egypt colored by the same color code. And then this atlas was actually segmented into 4 main regions in Egypt. So we have the Upper Egypt, the Lower Egypt, and we have the frontier governments, and we have the central governments. This is what we call the Delta region, for example, having its governorates color-coded. And when we go down to one governorate, for example, this is Port Said and Suez, the Cairo and Alexandria, the urban governorates. You'll find that we have at the very top the indicators collectively over there written, and we can have a snapshot of comparing the situation in the different governorates regarding health and education and environmental conditions and women empowerment and availability also of the NGOs. And to put ourselves clear, we decided that this year, that's the 16-17, we are targeting only the red zones with extra workload, and we are targeting the yellow and green with our regular activities, and this made us define 86 red spots in Egypt that worth further more attention so we can bring the population development in a very fast fashion. Our table is supposed to have red, yellow, and green matrices, as you can see, but when we speak about policy, we are only targeting the red with extra efforts. And we have here, for example, this is the caliber government rate. We have it in color codes, and we have it also in extensive table defined, and this has been delivered to the governors themselves and to the different ministries to make them have one common vision where to go first and what to invest in most. Maybe I'll stop at here with this kind of scientific progress we have made at the National Population Council. We also were able to create a population observatory system for population surveillance for one and the same reason, so we can achieve better results very fast, inshallah. I'm open for questions, and thank you very much.
Very high birth rate is a big problem in the Middle East. How successful have you been in controlling the birth rate, let's say, in the last 10 years?
Well, in the last 10 years, there has been ups and downs. The best implementation of population policy was run between 2004 and 2008, and this was proved by the demographic and health survey in Egypt, is that the birth rates came down. And then what happened next between 2008 and 2014, because, we don't read in between the figures. We only read it every 4 years. So by 2014, there has been a slight increase in the birth rates, and it's been said that political non-interest in family planning and the population and demography issues all through is to be blamed for not bringing the population down at this moment. What I can say now is that we're having serious political advocacy for the population rapid rate of increase and for the population development in particular. This is something, as you can see through research, we can reach better outcomes, and it's not only through effort exerting, it's exerting the necessary effort and in the correct place at the very beginning.
What is the rate of infertility in Egypt?
Well, we don't have a figure for infertility in Egypt. However, the population policy helps infertile couples to get their service to become, to be able to have a baby born. But we don't have a figure for early marriage, for example, and we don't have a figure for infertility. And I mean a national figure.
I just want to say it's great to have you here, Dr. Maissa, and also I just wanted to tell you one of the things, there are many prospects now in Egypt for cooperation, for health, for business, for computers, because the management all over Egypt now is reforming. And this is an ideal time with this reform. They're putting planning with big companies, and we hope to see a fruitful thing. Also, as Maissa said, that there is a major sector of the public hospital that undergoing public-private partnership or is undergoing reform, and this is a big thing for a lot of the companies interested in hospital rehabilitation. Also, in pharmaceutical, there is a great reform happening, and there is an opening for the pharmaceutical section in the biotechnology, but also they are thinking now in a better way in trying to put criteria that ties with the rest of the world regarding the quality of the pharmaceutical. I think, thank you very much. And
maybe amongst the good news is that earlier cooperation between Pittsburgh and the Ministry of Health has yielded Nasser Institute as an accredited governmental body. And looking into the future, it's been like a couple of weeks ago that the Parliament has allowed the development of the Egyptian Drug Administration body to facilitate things go on in a faster fashion. Thank you so much.
Thank you. And those of you who are coming to this evening to our Dan Rather special event, we're pleased that we will have the Deputy Minister, Dr. Maissa, there this evening, and hoping we can build upon your goal for public-private partnerships. And thank you very much. We know that there's a great opportunity in Egypt, and we look forward to building upon that. Thank you.